Good morning, everyone. We've still got people joining, so we're going to hold on starting the presentation. Thank you for joining us. Good morning, everyone, and welcome to Partners Community Cafe for August. This month, our focus will be recovery, and we do welcome you to show your faces and be a part of this discussion as we go through. We will offer an opportunity for a conversation as we go and have some Q&A. And we do ask, however, that we focus on this month's theme, which is a discussion about recovery, getting ready for next month, where September is Recovery Month. With that, we're going to go ahead and get started with our first speaker. Gina Hoffert is with the Partnership for Children, the Sun Project. Welcome, Gina.
Thank you, Jerry, and thank you, Robert, for inviting me. I love being able to be a part of this. Hello, everyone. I love seeing everybody's faces and names. This is super exciting. I am the program manager for the Sun Project. And I'm going to start off by showing you a video. I think it does a nice job introducing you to the work that we've been doing for the last couple of years here. And just if you'll shoot me a text if you can't hear the volume, that would be great.
Hi, my name is Brooke. This here is Christian, my son. My heart, my whole world. I'm truly blessed to have him. He is truly a tiny miracle. The word tells us that every good and perfect gift comes from above, and that's truly what he is. He's a gift from God, and I'm so blessed and thankful to have him. I actually heard about the Sun Clinic when I went to the ER at Northeast Medical. I was very sick. My fiance actually took me. I was running a fever, body aches. I didn't know what was going on, so he took me to the ER, and I was very dehydrated. I got the fluids I needed, and I was also out of my medication. And that's one medication that the Sun Clinic offers. The doctor actually came in and told me some news that I was pregnant. And that's when she told me about the Sun Clinic and gave me the information. The first time I went to the Sun Clinic, I was nervous. I was scared. I didn't know what I was going to walk into. But, you know, Dr. Suda and Sonia made me feel so comfortable. I was able to be honest with them, no judgment. It was like a sense of relief. Like I didn't have all this weight on my shoulders. I was able to lean on someone and them help me. And that was the main thing. That was a sense of relief. What I would want other mothers to know about the Sun Clinic is it's a safe place. You can go and be honest. And mothers that are going through what I have experienced or that are still going through the traumatic experience, there's nowhere to go. So it feels safe, and you know, it gives you a support network, something that you need in recovery that you have to have. If you don't have that, you're going to set yourself up for failure.
The program creates a network connecting mothers to doctors, social services, hospitals, and other healthcare providers.
Most doctors traditionally would say, I will do the medicine and then I'm going to refer out for all the other stuff. That was kind of the old way of doing things. Dr. Suda really kind of is a pioneer in saying the old way's not working. I would like to be at the center of providing care for her, working collaboratively, knowing that I need your expertise in other areas to provide the best care for her.
The rate of pregnant women misusing opioids across the country has quadrupled since 1999. Untreated opioid use disorder during pregnancy can have devastating consequences for the unborn baby. The Sun Project helps patients get connected to medication-assisted treatment. It helps prevent withdrawal during pregnancy and minimizes the unborn baby's exposure to dangerous substances.
It's nice to know that in the community, the word is getting out that you can come here and you're not going to get shamed. You are not going to get turned away. You're not going to be told that there's 25 hoops that you need to jump through before someone will actually see you. And then you also get a physician who actually says, I'm really proud of you. Thank you for coming. This makes you a great mom.
All right. Little patience as I transition from one screen to another. Thank you, thank you, thank you. So that is one of our Sun Clinic moms. She really is a superstar. And we're so proud of her. So, let me pull my PowerPoint out of my other screen here. All right, can everybody see my PowerPoint? Thank you, appreciate that. All right. So what we have been working on over the last several years is developing a cross-sector, collaborative, compassionate. I actually had to add that word after a couple of years of working on this. I didn't realize we would need to add that in there, but when it comes to working with population with substance use disorder, I wasn't ready. This isn't something it's not my background. But stigma was kind of coming up and I realized, oh, we need to add the word compassionate to our work. But really creating a compassionate system of care for pregnant mothers who have a substance use disorder, as well as their infants and their families. And our goal really is to be able to have healthy, safe babies stay with their healthy, safe mommies. And the reason for that is that we know that in the recovery journey, one of the highest and biggest motivators for mothers is being able to keep their babies. If they are able to stay with their children, that really motivates them and have behavior change that they've never really been able to do at other points in their time, in their life. And so having that motivator really allows them to stay on a road in recovery that they haven't been able to accomplish in the past. And then we also know statistically that for children to not be placed out of the home, if they're able to stay in a safe environment, that reduces their ACE scores and also future use of substance use as well. So we really do everything that we can working with other sectors, social services, to be able to create environments and support moms and babies to be able to have that baby mother dyad stay intact and be healthy as much as possible. And so that's beyond just the medical piece of and treatment of a mom, but really looking at that as a unit. And that's a very different perspective. Usually you have, someone treating mom, someone treating baby, DSS coming in with his own very own perspective. And now we're looking at this of how do we do this collectively? Because we recognize that if we can do this together, it impacts all of it. We also look at increasing best practices across all of the sectors, and doing this with science and not just kind of, we think this is going to work, but using science across that. Of course, improving maternal and infant health outcomes, reducing provider stress, frustration, and burnout. This is a huge piece of what we do. So I work at the systems level. I provide no kind of clinical work. We don't provide any direct patient care. Our focus really is supporting agencies and providers, recognizing that if providers are not having the resources, training, support that they need, they're not going to provide good care. Not because they don't want to, but because they can't, or because of their hands are tied, or because the system is just broken. And if they can't provide great care, then they're not going to get good patient outcomes. And so we're recognizing that we need to be able to, that's where the system is broken. We need to be able to provide the support that we need to our providers. And then also in that way, we minimize duplication by being able to jointly work together on collective goals. And in turn, we reduce cost. I'm gonna start at the very bottom and then kind of work up on how we work as a system. And at the very basic level, what we have is the Sun Clinic at the Cabarrus Health Alliance. And you're gonna hear some nuances there. The difference between the Sun Clinic versus the Sun Project. I know, and it's similar, but it's very different. So the Sun Clinic is where the clinical services are provided, and that is at the Cabarrus Health Alliance, which is the public health department. And that is where clinical services are provided for the Sun patients. That's where they get their prenatal care by Dr. Suda, who's the OB clinic, who does specialize, has trainings in addiction medicine. They get all their ultrasounds. That's where they're able to get their medication to treat their opioid use disorder in the form of buprenorphine. This is huge because in the past, they'd go to an OB, then they had to go somewhere else to get their medications for their opioid use disorder. Here, they can do it all at once. And it really serves as a motivator for them to come and get their prenatal care. And we know to be able to have a healthier baby, then prenatal care coupled with medication for their opioid use disorder together is what's going to get a baby to full term. And so now they'll come in for their scripts and get that prenatal care all in one visit. So this is really proven to be very, very successful. And they're coming all to one place that feels safe to them and is non-stigmatizing and is catered just for this population, which is huge. They're able to get mental health and substance use therapy there by licensed clinical social workers who specialize in this. And at the same place, they've got nutrition counseling, case management, recovery support, WIC, dental care, newborn care. It's really integrated care at the health department, which is really nice for any population, but especially a population that tends to be limited in resources like transportation. So it really has been proven to be very successful for them. One of the things that we all know and hear about quite a bit is that social determinants of health obviously impact their health, but none of us are really funded to address those. So as providers, what ends up happening is we know that this impacts it, but we can't seem to address it or do anything about it. And so the Sun Project is been really rewarding because we have funding that specifically is looking at the fact that we know that if we don't address these social determinants of health, we're not going to be able to help mom in recovery, right? So it does not matter how phenomenal of a 15 or 30 or even hour appointment Dr. Suda gives a mom if she has to go home, if she even has a home to go to at all, in very adverse situations, right? If in order for mom to be able to stay in recovery, we're going to need to make sure she has housing and has sufficient food and has transportation and is able to stay in recovery and has all those supports. You all obviously in this field know all that. And so to be able to have the doctor who previously was very frustrated and saying, there's only so much I can do in a 15-minute appointment, but I don't have anybody else who's helping me address all of these other things that I know impact the medical care that I give her, is really nice because now we all are able to work together and sit at the same table, which is like crazy in post-COVID world where any of us sit at the same table anymore, and work together to say, hey, Jane Smith came in last week, and she's terrified about delivering next week because she doesn't have housing secured, or she's terrified about anesthesia because she's worried about the fentanyl and the epidural, and we're now able to all talk about this at the same time, while before none of this was being coordinated. So we're able to address all of this collectively and very efficiently, which is fantastic. So what we were seeing in the past is you either had the patient, interacting with all of these different providers, DSS, the medical provider, her clinician, most of the time they're, involved with some kind of, criminal activity. And so then they had the probation officer, and they're all individually working with all of these sectors, getting bombarded, with all of these different messaging. And then they had all of these case plans with all of these different people, which is extremely overwhelming for anyone, but especially someone who's also trying to navigate the recovery. Or you had providers who were, talking sometimes to each other, not necessarily to all, not coordinated, and kind of leaving the patient out of it. Social services and law enforcement tends to have that reputation of kind of talking to one another, but not necessarily giving the patient all the information. And so it really wasn't patient-centered. And so what we've moved is into this kind of model where we've created what we call like kind of this orange space where we're all in the same little space at the same time, and we meet in real time to discuss this patient's case plan together using a patient-centered approach. And to create this orange space took 2 years, and we're actually still working. We're now into year 3 of legal framework in order to do that, because enter HIPAA, enter 42 CFR Part 2, right? Enter all of these, oh yeah, sorry, I'd really like to help you, but I can't because I've got all these legal restrictions in which I can't. So part of what we've worked on is with the UNC School of Government to figure out, hey, the law is here to help advocate for patients and providers, but at the end of the day, it can't get in the way of providing good care. So how do we work together? Because we need to be able to provide good care for our patients and our clients, and the law is supposed to help us do that. So help us do that, right? And so we've really been working very hard on creating the legal mechanisms in order to be able to provide agencies and providers the comfort that they need, that they can do this legally. How am I doing with time, Robert?
I think just a few more minutes before we open it up for some questions.
Awesome. All right, so kind of some key drivers here that we've got that's unique to the SUN project is that we've developed this framework using SANSA best practices. So it was developed, this model that we're using. I wish I could take credit, but I'm not that smart. So I just used it from a model that was done in Vermont. They wrote it all up, and I was able to take it and say, oh, this sounds like it would really work here in Cabarrus County. We replicated it here. It's been really successful, not without its kinks, not without its problems, but we continue to work for it. And now we're able to actually got some additional funding where we're going to be expanding it into Rowan and Stanley County if they're receptive and open to that. So we're excited about that. What it's got that's cool is that we've got the legal mechanisms in place to be able to connect medical providers to each other and to non-traditional partners to address those social determinants of health, which is unique and different that we've had in the past. Something also that is different is it leverages pregnancy positively, both within patients and providers. And that was different. I mean, even Dr. Suda will kind of share his personal story of how in the past, most OBs would kind of shame the patients that would come in, and say, what are you doing? Why are you using substances? Don't you know this is so bad for the baby? And would kind of shame patients out of their offices because they really didn't want to deal with these patients. They had bad medical legal liabilities, and they're like, high maintenance, out of my office. And they have even self-shame that they do that, but that was their reality. And so now we've really created a clinic that understands that this is something that they can treat. And now are creating a safe place where clients can come and receive care in a very caring way. We really use a harm reduction model. We really look at the fact that mom is medicine, and this is actually in a hospital setting using an approach called Eat, Sleep, Console, where they're giving babies less morphine and using the Finnegan score less, and they're using mom as medicine, where they're recognizing that what soothes babies more for neonatal abstinence syndrome, or NOWS, they refer to it, is actually swaddling, nursing, low lighting, crazy, but that the mom was the more soothing thing for the baby than pumping them with morphine and sticking them in a plastic box in the NICU. It took like a study at Yale for them to realize that. So we really do that. And then we're trying to incorporate the voices of people with lived experience more and more. This is our governance structure where you can see you've got the clinical care at the bottom. That orange space is that care coordination team meeting where we have all of these partners that you see here to the right. We've got you guys, partner health management at the table as well. All these people have, memorandums of understanding of the legal mechanism to come in and sit at the table and share information about the patient so that we can be able to manage their care well. And then we lead this all the way up to the governance group where we see systemic issues coming up over and over again. So we address that and say, hey, over and over again, we're seeing this issue like with pharmacies or this issue with funding, whatever it may be, to try to collectively work on this over and over again. If you're curious as far as outcomes are concerned, we've had 40 patients, we've had 0 infant deaths, 0 maternal deaths. We have about a 91% delivery rate of 35 plus weeks. That's crazy. Like nationally, moms that have a substance use disorder that go untreated have babies that do not deliver at 35 weeks. That is a stellar gestational age for this group. Those are healthy babies being born. High adherence to MAT. This was a study that was done externally through UNC School of Government. They came in and did an evaluation. We've got high retention rates. Again, that high gestational ages average is about 38. And then the social determinant of health needs met about 61%, which is, we're proud of that. I'd like to see it higher, but traditionally not having any met has been really, really cool. If you're wanting some additional resources about where you can get some more information, here's some that you can have. I can send this PowerPoint afterwards where you can click on this, including the video that we watched earlier today. And then if you want to send some patients over, you can send them over to the Cabarrus Health Alliance. That's that upper information there. And then the lower information is if you want information about the project itself from a systemic standpoint, including my contact information. And then I'll always just include information about how we've been funded. And then that's it.
Thank you, Gina, for all that information.
Absolutely.
Does anyone have any questions for Gina? We want to take advantage of the time we have with her because she does have to jump off for another meeting. So if there are any questions, feel free to put them in the chat or go ahead and unmute and ask them before Gina has to hop off.
Thank you, Gina, for that presentation. While I was listening, I was already starting to take down some notes and text some people in my area to probably follow up on bringing this to their areas as well. I'm probably a couple of ears that I'm aware of on this call today are like, ooh, we need to go talk to Gina to bring this to our community. It's a very powerful project. So thank you for being willing to present. I was literally texting while I was watching the information as you were speaking about it. So really appreciate this. Very powerful for mothers and expecting mothers. The whole focus there is so powerful. So thank you for being willing to present. Our next speaker today will be Terry Blankenship. She is with Iredell County EMS Community Response Support Team. And I'm going to turn this over to you, Terry. Thank you very much for joining us.
Thank you, Jerry. That last presentation was so good. That was so encouraging to hear about all the work they're doing. Thank you for inviting us to share today. I do have some slides to go through. I do have quite a bit, so I might fly through some of them. So if anybody has any questions or wants a copy of the slides, just let me know. Okay, so I am with Iredell County EMS, as Jerry had stated. I work on our community response support team, and I'm just going to quickly go over some of our proactive programs that we have. We are located at the Public Safety Center in Statesville. That also doubles as our Statesville emergency service base. These are the 5 W's of our programs. First, we are currently a team of 3 peer support specialists, and we're in the process of adding a 4th peer support specialist, which is very much needed, and we're very excited about it. We have 2 full-time community paramedics, and of course, the support of our administrative support staff. Our what is we offer support and referral services to people who have either recently overdosed, are facing addiction, have a chronic disease, or have had more than 4 EMS encounters in a year. We try really hard to follow up within 24 to 72 hours after either an overdose or substance-related 911 call has happened or a referral from the community has been made. We serve all of Iredell County, and our substance use services kind of bleed over into other counties sometimes, especially with people who may be transient and staying at different places, as that sometimes happens with these populations. And our missions are to better our community, instill hope, offer resources and support, reduce harm, and show our vulnerable citizens that their county does care about them. So the 2 primary focuses of our community response support team is our peer support specialists, who focus on things like substance use disorder, problematic alcohol use, overdose, and people who are justice involved. While our community paramedics focus on frequent falls, chronic disease, unsafe living conditions, and medication mismanagement, and all of those things and how they lead to an emergency 911 call. And this represents the overlap that we have. We see quite often that that a lot of these issues overlap. Somebody with substance use disorder, maybe they are trying to cope with some kind of medical ailment, a chronic disease, or something like that. So we do work together quite a bit. For our community paramedic program, their main focus in the beginning was frequent falls. They do in-home safety assessments and provide fall prevention education to the families, which makes a really big difference. Chronic disease, they can help with getting a primary care provider if the patient doesn't currently have that. They can help with medication compliance, work with their primary care providers, help with getting connected to specialists and things like that. And then, of course, anyone who we would consider a high system utilizer, that would be a person who has had 4 or more EMS encounters in a 12-month period. We like to go out and try to figure out if there's anything that we can do to connect that person to the healthcare community. So this is kind of how our community paramedic program operates. EMS generally responds to a call, or a referral is made from the community in general, but often from our paramedics when they're out on the scene of these different situations. And once someone is identified as being a good candidate or a good fit for the CP program, their scheduler reaches out, kind of explains what services they have, the resources that they can offer, and they schedule an intake visit. And then the community paramedic goes out and they do a few different screening procedures, some assessments of what needs to be done, and then they address those needs. It could be anything from wound care, help with disease management, administer medication that can help monitor the vitals, and other identified services. And then the peer support program operates in a very similar way. We just have different focuses, and I guess you could say different specialties and backgrounds. So first, we always support the individual, the person who is struggling with substance use or problematic alcohol use. We always hope that we can help guide them towards recovery, but that's not always possible for right now. So we do have a safe for now approach. We do support the family as much as we can. Of course, prevention is huge for us to prevent future addictions and substance use disorders. So we provide education to parents on proper medication storage, different warning signs, and then we can help link the families to community resources and unfortunately grief support after a substance-related loss, because it does happen. And then we're also here to support the community in general by attending events and awareness opportunities like we're doing right now. We do Narcan trainings in the community. We do a lot with our sheriff's office and our police departments, and participate in medication take-back campaigns. And similar to our community paramedic program, this is how our peer support program operates. After there's an overdose or substance use related call, or a 911 call or referral is made to us, our peer support specialist actually reaches out to them, explains that we have lived experience ourselves and that we, understand what they could possibly be going through. We can offer to take them out to lunch. And if we need to, we can go to their home. We try to meet in a more neutral, safe space, like a coffee shop or something like that. And then we just sit down and kind of get to know them. We really try to take our time, especially that initial visit, to help them figure out what's going on and what their needs are, what their goals are. And then we help that person to address their needs. We're not there to do things for them, but we're there to help connect them with resources and help just be a support and guide them through the many different systems that can really be overwhelming and complicated whenever they're struggling with something like this. And then we continue to follow up for at least 3 months. A lot of times it's a lot longer than that, especially if somebody does go into like a 90-day inpatient program or something like that. And we're not going to cut anyone off, after 3 months, but we've worked with people for up to a year. It just depends on the situation and what their needs are and what's best for them. So this is what used to happen before we had an overdose response team. Just really quickly, a person uses a substance and they either live or they die and they just continued using, or somebody uses a substance, they overdose, and police and EMS is dispatched. Often Narcan is used to revive that person, but they refuse transport to the hospital and they just go on with their day. And generally it's not the last time, most times. Or what would happen is somebody uses a fatal amount of substances, EMS and police are dispatched. They go out to the scene, the person is transported to a local emergency department, and the person usually there's not a lot of treatments after somebody is given Narcan or is overdosed, and they're usually just observed for up to 6 hours. Most people leave before then. They're usually not feeling very good. They just want to get out of there, a lot of shame and judgment and just wanting to leave the ED. So most of the time they're not offered any kind of treatment or additional resources or anything. And that's not to say anything bad about the EDs. They're very overwhelmed, especially right now with the state of everything that's going on with our hospitals. But they just don't have the capacity, they don't have the resources and things to truly help somebody who does want to seek recovery and does want treatment or help with other things. So then obviously only a small percentage of people actually reach recovery in this way. So now that we do have an overdose response team, the majority of those overdoses are funneled through us. Even if the person refuses transport to the hospital, at that point, a paramedic can call a peer support specialist and we can go out to the scene and talk to that individual and their family. We try to help to meet those immediate needs, which often is just shelter for the night, maybe a meal, clothes or shoes. Then we can work on more long-term goals, like stable housing, transportation to doctor visits and things, medication, assisted treatment, outpatient therapy, or inpatient treatment if that's what they're willing to do. And we have a lot of resources to be able to connect them with those things. So then a bigger percentage of those people who do experience an overdose can reach recovery. So this is an example scenario. I won't go all the way through it. It would take a while. But imagine we get a 911 call for an overdose, a 26-year-old young female with 2 young kids in the home. It appears to be a very unsafe, unstable living situation. She doesn't have transportation and she's using opiates 3 to 4 times a day. So this 911 call, we screen all of our charts, but we often get referrals for these things too from our paramedics to get additional information. We meet with this person and we get to know her and her story. We all have a story and kind of how she got to where she is today. And so we discovered that she has a lot of medical issues in her background since birth. There were opioids introduced at a very young age medically for different surgeries and procedures. There were many addicts and alcoholics in the family growing up. As a teenager, she becomes a teen mom herself and loses her own mom in a tragic car accident. This is when she's prescribed benzodiazepines in addition to those opiates. Shortly after that, her dad starts using drugs to cope with the loss of his wife, and she finds her dad dead as he overdosed, also 9 months after losing her mother. So she begins controlling that psychological and emotional pain with the benzos and the painkillers, and becomes addicted and dependent on these medications. This led to a cycle of chaos. She no longer gets high anymore. She can't hold a job, can't pass a drug test, unstable housing, is in and out of jail. So of course, this just causes more trauma, which leads to more chaotic drug use, more trauma, and more drug use, until she reaches a breaking point when social services, child protective services becomes involved, and she loses custody of her oldest child. She loses everything that she owns, all of her belongings. And this is when she reaches out for help. She calls all those places that we were taught as kids to call whenever we need help: our doctor, the social workers at DSS, law enforcement, the hospital, your church, your family, and nobody knows how to help her. She can't go to inpatient treatment because she doesn't have child care for the younger child. She doesn't have health insurance, and she can't find an outpatient treatment center that's accepting new patients, and she doesn't have transportation to get there anyways. So what could we do to help? We could jump in depending on what is most critical in the beginning. We could help get referrals to primary care, help her fill out those Medicaid and EBT applications, and just support her through that very long process. We can get a referral to one of our many great MAT providers in the community, where they can also get some long-term peer support. We have transportation vouchers and ride share credits and things like that to help with transportation for the doctor's appointments, and to get groceries and things for the kids, and other things like that. We can help her get the grief support that she needed a long time ago, that could have maybe helped to avoid some of this and learn how to deal with some of that trauma and grief. And then we help with all of the social determinants of health, like food and housing, and employment, resources, childcare, legal advice. We don't provide legal advice, but we do have resources for that. And then if the person doesn't want help, we do, or if they're not ready for recovery or ready to go to treatment, we do pivot to a harm reduction strategy. For us, this means that we just want to keep them safe for today. The reasons for that is harm reduction engages individuals to participate and stay connected in the community. A lot of times it creates the opportunity to plant a seed. So when we go out for a visit or a door knock for the first time, and we have Narcan, it's a way to show compassion, that we just want to make sure that you're going to be okay and live to see another day, and hope that one day that they can reach recovery. Harm reduction also helps to prevent the spread of infectious disease, which is great for our public health in the county. Most recently, we were awarded some additional funding this year to expand a little bit and support our justice-involved individuals a little bit more. That includes supporting our first responders and our law enforcement officers, some additional trainings for our paramedics, and some other resources for the people who do participate. And with that funding, we are starting an MAT bridge program where, in short, our community paramedics will essentially be able to administer Suboxone for a few days while we're connecting that person to treatment, to help prevent some of those overdose deaths that are occurring, which has been a very long process, a lot of hoops to jump through and legal issues. Back to my example scenario, this is actually my own personal recovery story. I was the young girl who became highly addicted and dependent on opioids and benzos at a young age, and went through a lot before I eventually was able to reach out and find the help that I needed. And now I live I'm almost 8 years in recovery. I have a great family. Love doing this kind of work and sharing my own personal story to help guide others to recovery. And here's my contact information. And I can also put it in the chat.
Thank you, Terry. I did see one question that popped up in the chat. Have you considered sharing these best practices with Cabarrus EMS and other counties?
Yes, that's a really good question. So we have done that quite a bit, especially recently with our medication-assisted treatment bridge program. There's only a couple other counties in the state doing that, and there's not a lot of guidance out there at the state level or at any level really to help people through that process. So we have worked pretty closely with a few of our surrounding counties all the way to, we spoke with a county in New York recently to talk about how they can kind of get started and where they at. And we're willing to share anything that we have. There's no reason to reinvent the wheel. So we're more than happy to share documents, forms, or give advice.
Awesome. And then one more question. How many or what percentage of the EMS calls are for overdoses each month? And has this number increased over the past several years?
So I don't have any current data with me. I'm not in my office right now. I'm actually at a training myself, and they allowed me and accommodated me to come and speak on here for a few minutes. But it has absolutely increased, just like it has in most places, especially since 2020. But we have been seeing a lot of spikes, that we won't see any or we might get 2 or 3 overdoses over a month period, and then the next month we could get 12 or 13 overdoses.
Thank you again, Terry. And I see Terry a lot. We work on several projects together in the community. And I really appreciate you joining us. I do look around the room and I always think, who's not here, and really want to push for future events to, think about this as stakeholders and community. And that's more than just providers and the people that you're seeing here. And please invite the rest of the community, business owners, the rest of the community to come to the school systems, et cetera. I see a few on here, but my hope would be there'd be 300-400 people on here. Hey, Marlene. And we're, growing this because these are powerful. And, as I was listening to the first 2 speakers, we could spend the entire presentation just hearing about that and spend the entire time. And I know with Christy coming up, that would probably be the same, speaking about what she's got going on as well. So with that, Christy Hamill with Integrated Care of Greater Hickory is our next speaker. And welcome and thank you for joining us.
Thank you. Thank you for having me. Thank you for sharing that, Terry. It was wonderful. So I work for Integrated Care of Greater Hickory. We are a behavioral health agency that spreads again across 5 counties. And we work with EMS, and we're working with Terry in her bridge program a little bit. So once those people that overdose get Suboxone, then they can refer out to us for a little bit longer term treatment. So we help people with medicated assisted treatment. We do intensive outpatient treatments and comprehensive outpatient treatments at ICGH. We do individual counseling and group services it's a little bit more intensive recovery program than most places. We have a lot of sober living homes that we're opening up right now. That's our really big project. We have 5 different sober living homes that people can go into. They are state and federal funded, so free for people, which is a little different than most sober living homes. They would get treatment with ICGH and be able to really work on their life and get to a stable point so that, they can transition out and be in a really good spot. And I'm like Terry, so I had many years in addiction myself, and so have most people that work at ICGH. So we really know how to connect with these people. We give them peer support, transportation. We help them in all aspects of their life. So, and I wish I had a PowerPoint like Terry today, but I was not quite that prepared. But we are working with TASK, DSS to help people be reunited with their families. We help people get through probation, get to court appointments. We literally come into these people's lives and just help them with pretty much anything they need to get to a better spot. So, sorry, I don't have too much more to share, but if you guys have any questions, just let me know.
Thank you, Christy. And just for everyone that's on here, I did put their email, or excuse me, their website address in the chat box. So if you have any questions, there's a lot of information on their website.
Thank you. Yes, thank you.
Thanks again to all of our speakers, and we greatly appreciate everyone coming today. We're going to spend a little bit of time now, and Robert's going to lead, and he's going to give some information about some things happening in the communities that we serve. And after Robert's done, if you've got information about something you're aware of that hasn't made it to us yet, please share and let people know. So with that, Robert, I'm going to turn it over to you.
All right, so I am sharing my screen. What we did is we asked some of the folks in our catchment areas just to send us some events that are happening in September, October for Recovery Month. And this is some of the events that we were notified of. There's an addiction awareness event coming up on Saturday, September 17th in Winston-Salem. The time is to be announced at a later date. So I believe if you go to their Facebook page, they do have that information. They're updating it. There's also the Burke Recovery Rally happening on September 24th, 11 to 5 p.m. Catawba Meadows Park in Morganton, North Carolina. We also have Overdose Awareness Day, which is on August 31st. And there are quite a few counties that are doing different events. The ones that we've highlighted here are the one that is happening in Stanley County, 6:30 to 8 p.m. Again, on their Facebook page, they have more information. There's also one in Monroe, 10 a.m. to 2111 Stafford Street. And then there's also one in Gastonia County, or excuse me, Gastonia on the 30th from 6 p.m. to 7 p.m. Again, we're going to share this flyer with everyone that's registered for this event. So this will be emailed out, but feel free to go to their website or scan the QR code to register for these events. For Cabarrus County, they will be hosting a recovery, I think it's a rally on October 8th. More information will be coming out on that as well. That is going to be at the Atrium Health Ballpark in Kannapolis. That's an amazing stadium if you have not checked that out. So again, more information to be shared at a later date. And then a really cool thing that Catawba Valley Community College is partnering with multiple partners. It's called Recovery Happens 22, and they're going to have a 4-week series on just different events. I believe if you go to their website, they have the registration link, and it's my understanding that these events are free. So it starts on Tuesday, September 6th. Again, they're going to have just different events, different speakers, different topics, and they just really want to just get involved with the community and answer as many questions as possible. So I've just put a couple of their, I guess, keynotes that they're going to be doing. But again, if you go to their website, there's a lot more information. And again, we will be sending this flyer out. So like Jerry mentioned earlier, if anyone knows of any of their events, please feel free to unmute or share those with us. That way we can get those shared to the different communities that we help serve.
We have one coming up in Iredell County. I just put.
And I apologize. I did forget that one, the Iredell Walk for Recovery as well. Oh, sorry, Kristen, you're muted.
This is a separate thing from the walk. This is actually a candlelight vigil that will be on September 1st, Thursday. It's a Thursday, from 7 to 8 o'clock. And all the information is in the chat. I put the address. There's a link to the event on our Facebook page. And also I've put my email in there for anybody that may have any questions. There's other people on here I feel like maybe better qualified to speak about the walk. It's maybe Debbie or.
Okay, I'll talk about the walk. The Iredell Walk for Recovery is on September 17th. That's a Saturday from 4 to 7 p.m. at ESC Park in Troutman. It's our 5th annual event, and we're so excited to be back in person this year after a 220 virtual event and a 221 drive-through event. We had 750 in 2019 for our last in-person event, so we're hoping we have that many folks out again. We have a concert, live music. We have food by Grillin' for God. We have, I think, about 25 to 30 vendors. Kristen, she's in charge of that. We have from the community, we would love to have more folks who are on this call who would like to come. You can contact Kristen if you would like to be a vendor at the event. We have lots of kids activities to bring in families. Where there's a splash pad, great playground. We have face painting. We have a magician, photo booth, all kinds of fun things for the family to do. We also have a wonderful art tent that's going to have a display of our very own Kristen as in her recovery story, and Shane Smith, Shane Nixon rather. Shane Smith is one of my former students. Shane Nixon is going to be our MC, and we're really excited about that. He's the DACI director. So we're just going to have a great event, and we hope you'll all come out and join us either as a vendor or as an attendee. Did I forget anything? Okay.
Thank you, Debbie. And I do apologize, I forgot to mention that event. I just did put the link for the Eventbrite registration in the chat. So if anyone wants to register, they can. Like Debbie said, there's a lot of great vendors showing up. I attended the event last year with Jerry, and it was awesome just to be a part of that.
And I will say for everybody, if you know of something happening in the partners area, any of the 14 counties we support and serve, and we missed them, it wasn't intentional by any means, but please get us that information, email it to someone with partners, and we will do our best to get it out to the communities that we serve. It's very important. Recovery, we recognize it in the month of September, but it happens 12 months out of every year. So please send us an information and we will share it. LaQuisha, I think.
Yes, thank you. Jerry, well, on behalf of Community Cafe and Partners, we want to thank, first of all, our speakers today. Thank you so much for all the information you provided. It was very informative and very beneficial. We would like to thank you all for joining us, and we do hope to see you next month, where we will be discussing suicide prevention and awareness. So we thank you again. Share this with all the individuals that you know to just come on and join us each month. And we hope you have a great day.